Hey everyone, welcome back to the channel. This is Aryan Malik and we are in Study With Me series. Today is day 15. We'll be talking about asepsis and sterility, and then we'll be diving into what is the proper way of donning and removing PPE. So let's get into it. So, asepsis is basically absence of disease causing organisms, but when we talk in terms of medical asepsis, the aim here is at reducing the number of bacteria or organisms, and it requires gloves and hand washing because that's the best way of minimizing germs. Because as registered nurses, we need to remember that the clients that we see, they are at high risk of infection sometimes, so we need to be very careful and maintain a sterile environment whenever we are near them, and especially when we give them meds or we change their wound care dressing, because those are the times when uh, they are at higher risk of catching an infection, so we need to be very cautious. And when it comes to surgical asepsis, it differentiates a bit from medical asepsis because it goes much more deeper into maintaining the safety of the client, because it aims to eliminate bacteria or organisms, especially when we are changing a Foley catheter or when a surgery procedure is being done, or even when we are changing chest tubes. Now, hand washing, when we talk about it, it is actually the best way to prevent germs, and it requires soap, water, and friction, with friction being the most important factor that helps us eliminate the germs here. And depending on how soiled your hands are or how clean they are, after you have, say, you are about to leave the patient's room, you need to wash your hands from 15 seconds to 2 minutes. And it is usually before and after seeing a client. When you are changing or putting on the gloves, it is very helpful for you to prevent infection if you wash your hands very carefully. And alcohol based hand sanitizers are okay only when you have done hand washing throughout the day, and the hands aren't that much soiled. So alcohol based hand sanitizer can be a go-to. And the last thing is, when you are sneezing, make sure that you cover your nose or mouth with your elbow or your shoulder. Don't sneeze into your hands because you are increasing the risk of the client catching an infection. I hope you found this video helpful. Please stay tuned for more videos that will be coming out in the future. Thank you.